For ReachMD, this is Audio Abstracts, produced in collaboration with the Crohn's and Colitis Foundation. I'm Dr. Jordan Axelrad, and I'm an assistant professor of medicine in the Division of Gastroenterology in the Department of Medicine at NYU Grossman School of Medicine, in addition to being a gastroenterologist at the Inflammatory Bowel Disease Center at NYU Langone Health. I'm also a faculty member in the Vaccine Center in the Division of Infectious Diseases and Immunology at NYU Langone Health, a member of the Executive Council in the New York Crohn's and Colitis Organization, and a member of the Crohn's and Colitis Foundation's Rising Educators, Academics, and Clinicians Helping IBD Group, or REACH IBD. Today I'll be reviewing an article published in the Inflammatory Bowel Diseases Journal titled Endoscopic and Histological Assessment, Correlation, and Relapse in Clinically Quiescent Ulcerative Colitis, or MARQUEE. This article came from investigators involved in the Crohn's and Colitis Foundation Clinical Research Alliance. But before we get into the article, let's start with some background information. Inflammatory bowel diseases, or IBD, like Crohn's disease and ulcerative colitis, are chronic inflammatory conditions of the gastrointestinal tract. Mucosal healing has emerged as an important treatment goal in patients with IBD. Mucosal healing, which is measured by various endoscopic scoring indices, is associated with improved outcomes, including higher rates of sustained clinical remission, corticosteroid-free clinical remission, avoidance of colectomy, decreased hospitalization, and improved quality of life. Histologic healing, on the other hand, is measured by various histologic scoring indices, and several studies have shown that it's associated with favorable clinical outcomes beyond mucosal healing, and is a negative predictor of disease relapse and of colorectal neoplasia risk. It's unclear, however, which endoscopic and histologic activity index or components are most useful in assessing clinically quiescent ulcerative colitis, or UC for short, especially in the modern era of more effective biologic therapies. That's why the MARQUEE study aimed to determine in patients with UC and clinical remission the following three things. 1. The prevalence of active endoscopic and histologic disease. 2. The correlation between endoscopic and histologic scores. And 3. The power of these scores for predicting clinical relapse. In a multicenter prospective cohort of 100 adults with UC and clinical remission undergoing surveillance colonoscopy for dysplasia, endoscopic activity was assessed using the Mayo endoscopic score, the ulcerative colitis endoscopic index of severity, and the ulcerative colitis colonoscopic index of severity. In addition, histology was assessed with the Riley index subcomponents, the total Riley score, and basal plasmacytosis. The majority of clinically quiescent patients had evidence of endoscopic and histologic disease activity. The correlation among endoscopic indices, histologic subcomponents, and total score were low. Nearly 1/5 of patients relapsed clinically over 1 year, with the Riley subcomponent of architectural irregularity being the most predictive factor. Given that endoscopy may underestimate the degree of inflammation in UC, this association between endoscopic and histologic scores was not surprising, but this extremely poor correlation was not expected. Limitations of the MARQUEE study included the overall small sample with few relapses and inclusion of patients from tertiary care centers, in which a high proportion of patients received immunosuppressive agents. That's why the results may not be generalizable to a community setting or to those with predominantly mild UC. The authors also suggest that larger prospective studies are needed to assess histologic predictors of clinical relapse in quiescent UC. If you're interested in this topic or others on Crohn's disease or ulcerative colitis, the Crohn's and Colitis Foundation's Inflammatory Bowel Diseases Journal provides the most impactful and cutting-edge clinical topics and research findings. For more information on the foundation, please visit crohnscolitisfoundation.org. This has been a presentation of Audio Abstracts. To revisit this episode and others from this series, visit reachmd.com/audioabstracts. This is ReachMD. Be part of the knowledge.